Hi, thank you for joining me on my fourth talk in Quarantine Positive series. Like I said, this is we'll have 9 talks. This is the fourth talk on how to treat lower back pain, mainly lower back pain or lumbago. Well, this is to treat a patient who was suffering from, who I was called in to treat him at home because he could not move due to a severe back pain, which did not allow him to move or have any motion, and a fear of maybe a prolapse disc attack. So first of all, if you have not to, this talk is the connection, we'll come to when we come to finalize it, is actually the connection between the second talk, which I spoke about treating headaches and points that you have here up on the scalp to teach headaches, and the talk that I done yesterday, the third talk on using points on the ankle to treat the whole body. So this is actually, this back actually brings us the connection between how influence in the area of the ankle treats different parts of the body, and how treating parts on the scalp treat different parts of the body as well, and help ease people suffering from the pain. So this is a patient he's 30, like I said, 36 years old. His medical history is at the age of 10, he had open heart surgery due to a womb in due to a problem in his heart, and he had the valves changed. This was from birth, he was born with this problem, and at that age he had the operation. So he had open heart surgery. Ever since then, he's been taking Coumadin for irrigation, so you have irrigation of the blood. About a year and a half ago, he had a prolapse disc in the back on his right side. So he had strong radiated pain for about a month. He was laying in his bed with not able to move. What helped him out was doing physiotherapy, and later on he started doing yoga, rehabilitational yoga, and capoeira, which was very much assisting him in his recovery. I was actually called now because he had another attack, but this time on the left side, which also left him laying down in the bed with no ability to move around. So he could stand for slightly not more than a minute. After a minute, he would start getting a strong increase in pain around his area of his buttocks area, the sciatic area. And after about a minute and a half, he started getting a strong radiated pain throughout his right leg. I done before he got up, I just done a straight leg test just to see maybe it could be another prolapse disc. He could raise it up to about 50 degrees with no pain, and after about 50 degrees, he started having this pain again. So I asked him to get up. Of course, it took him some time. And then I started looking at his range of movement to see where where the problem is coming from. So I like to look at anatomy planes, basically the planes, a sagittal movement, a horizontal movement, or frontal movement, to start locating on which channel the patient was suffering from pain. So when in a sagittal movement, if he's in a sagittal plane, I would ask him to move sideways, okay? Okay, I'll ask him to move sideways to see if there's any difference in the pain, if the pain becomes more and more severe, or if the pain lessens, okay? So when he was doing like I said, he had a problem on the right side. So when he slightly tilted to his right side, he felt a strong pain throughout the side of his body, and the radiated pain, shooting pain down to his leg, okay? When I asked him to turn to the left side, again, he felt there was pain there, not as severe as it was, but there was pain. in doing this motion, but it did not improve. Okay, so that was that. So I around it started saying my idea was going to the Shaoyang leg channel. Afterwards, I asked him to do to bend forward and backwards. Okay, and bending forward, he had slight pain, but not too much. Okay, and then sorry, he had pain, severe pain, bending forward. When I asked him to bend back, he said there was no difference, not less pain or no more pain. Okay, so that was frontal and anterior. Okay, then I asked him to do horizontal, okay, to move sideways. So I asked him to move sideways. Okay, when he moved sideways, he said actually when he tilted his hip towards the left side, he again felt the pain in the lower back, okay, and slight thigh pain in the area of gallbladder 34 point. Okay, so this started bringing me to think that what I have here, two channels that are causing the pain. I have a disorder in the Taiyang channel and the Shao Taiyang of the leg and the Shaoyang of the leg. So this brought me to my treatment with this patient. Okay, so that was one thing. I done my what I'm looking for in the motions when the patient is tilting his body to one side or either side. I want to see if it's more painful or less painful. I want to see if there's no change or if there's improvement. Each one of them will give me information. If in general I see improvement, I'll work on the opposite side to try and get the improvement even more. If I don't see any, I see more painful, I'll try again. That's the general idea, or no change. But so in the first treatment, I done according to the palpation of the elbow. In YNSA, we have elbow palpation, okay, to know which area of the cervical spine needs to be treated. And then I use the occurring points that are necessary. So in the first treatment, I palpated. I found that the cervical spine on the right side was sensitive, so I needled the A basic point. A basic point treats the areas of the head down to cervical 7 on the right side, and I found that the lumbar area in the elbow on the left side was sensitive, so I needled. Sorry, all this pain was on the left side. My mistake. Not he previously had on the right side. Prolapse disc on the left side. D point or an extra D point was needled on the left side due to a sensitivity in the lumbar spine area of the elbow. And then I also, when he was laying down on the treating table, I did bloodletting of the left side of urinary bladder 67. Okay, after I let out a bit of blood, he felt a slight improvement in the pain. Okay, and then I needled left side bladder 62, right side small intestine 3. Okay, and manipulated the needles at the same time and ran 3. At the same time, what I mentioned that in ran 3, he had a lot of sensitivity there, even when palpation and looking for the point. He felt actually when I palpated there, he had a strong radiated pain towards his hip. So these points were needled. And on the left side, I needled gallbladder 21. Basically, what I was doing here in the treatment, I was doing sinew channel treatment of the Taiyang channel, foot Taiyang, to release the pain, because I saw that was maybe the main cause of the problem, and less the Shaoyang. But I thought so because of the rotation, that I want to get more freedom of rotation in the upper area around the hip area. So I done gallbladder 41 to get more and more rotation to get the Shaoyang moving at the same time. Now, as you can see here, after about 2 treatments, there was, for the minutes that he was on the table and for the minutes that he had the needles inserted, he felt better, not tremendously better, maybe 10 to 15% better. But after about an hour after I left, the pain came back, and like there was no improvement at all. And this was actually there for about on for about two treatments. This was how the characteristic was playing out. On the table better, an hour after the treatment, it gets worse and no improvement. So I went back. So first, before I go back, I just want to explain and locate the location of the points which I needle. Okay, so go back to my drawing board. Okay, so D point, extra D point. Oh, sorry, my table is not connected. So coming back to D point. So D point is located on the anterior hairline of the sideburn. And it's in the height, on the anterior hairline, the height between the root of the ear. So if this is the root of the ear, okay, would it be here, and the outer canthus. Okay, in between the two, this will be the D basic point. The D basic point treats any disorders from the lower extremities down, from about the diaphragm down to the area of the feet. Could be also internal and also musculoskeletal. That's the D. The extra D point is located right here at just below the root of the ear in this region. And this is all for lumbar pain or for the lumbar spine. The upper area is L1. The lower area here is the sacroiliac joint. Okay, the sacrum. So you have the whole area here in between all the areas of the cervical lower back. Okay, that was the treatment which I done on the YNSA points. Next point is A point. A point is A point is the anterior aspect of the hairline. Okay, I look for the natural hairline, and it's approximately a 2 centimeter vertical line, which is located 1 centimeter above the hairline to 1 centimeter below the hairline, and it begins approximately 1 centimeter lateral to the mid-sagittal line. The upper area here will be C1. And the head, the lower area here will be C8-7. Okay, so you have that whole area of the upper neck and head. Okay, so these are the basic points which are used in YNSA. Okay, but like I said, there was no improvement. So I found myself going back to my drawing board, going back to my books and trying to understand why in the palpation I'm seeing sensitivity in the area of the neck, okay, and in the area of the hip with no change in with the treatment. And also, so this actually brought me, because I'm reading a lot about, in the last couple of years, a lot about fascia and the fascia manipulation method, Luigi Stecco's method in fascia manipulation, and how by manipulating the fascia, you can get better treatments and results. Now, so basically, when I was looking up the books, I started seeing a correlation between what we see here, a lateral motion, okay, of the patient, and why when he turned or done a horizontal movement or bent forward or the sideways, I was getting that sensitivity, but not enough sensitivity to really pinpoint where the problem is coming from. And at the same time, I have the bladder channel. This, if you look, it seems very, very similar to the channels or the acupuncture channels. So these were the two bases which I based my theory on. And I said, let's go see and ask the patient to do these motions in a better manner and see what happens, okay? Because I have, as you can see here, I have the Tai-Yang channel, and I have also the influence of the Shao-Yang channel. The Shao-Yang is the daimai switches sides, and that's why you have that rotation. And then it actually clicked for me. If you think about it, when I was needle in the upper area of the cervical spine of A point was actually treated in this region on the opposite side. And then the lumbar spine was on the same side because I was treating this region. Or what you can see here, similar. I have the right side, okay? So the right side and the left side, or vice versa, what we saw in the treatments. So this actually brought me to ask the patient another question. So when I saw him again, now, and one of my questions was for him, have you had any fractures or any damage in the past? And then he spoke to me and he said to me, look, about 2 years ago when I was traveling in India, I fractured my calcaneus bone. And I stayed with the cast in India and it did not heal correctly. So this started, lit my red lights up, and I asked him in what leg was it? And he said to me, well, it was in my left leg where I fractured my bone. And this started lighting everything up to me. Now, if you're familiar with the fascia manipulation method, the fascia manipulation method speaks about that you need the fascia to glide one on each other. If you don't have this gliding motion of the sheets of the collagen, of the connective tissue, it's gliding, it's 3 sheets that always glide one above the other, okay, and allow this gliding motion. In between the sheets, you have hyaluronic acid. But what happens when you have 3 levels? You have the superficial, the deep fascia, and the visceral fascia, okay, which covers very, very close. Now, usually the deep fascia is very, the superficial fascia is just below the skin. It's has a lot of elastin, so it's very, very easy to move about. But the deep fascia, sometimes the platelets or those sheets get stuck together, okay? And then you don't have any motion in a certain area. And when you cause some type of stretch, you're gonna get that strong pain. So when I asked the patient in this time to do some motion, I started seeing that there was more and more sensitivity in a certain area. So I'm just going to go up here, stop sharing my screen, so I could go to the motion which I was speaking about, and I'm going to go back a bit. So the key word was, like I said, he had a fractured ankle. So when I came to him this time, I asked him, okay, I want you to rotate. First of all, I want you to bend forward, okay? But at the same time as you bend forward, I want you, now ask him bend forward, so he bends forward. And then I asked him, okay, now flex your neck. When he flexed the neck, he had a strong, severe pain just shooting down, right down the leg, okay? And then I asked him, let's see if you bend, straighten up, bend forward, and when you bend forward, extend your neck. And when he extended his neck, he actually had more motion and he could move more and didn't have this pain shooting up. So this already started saying that maybe that was the area why I was treating A, because I had a problem in the neck. Okay, neck flexion or extension was giving me a different output. Okay, so basically, if you think about it, this fascia runs right from the back part of my foot, right through my upper vertebrae and covers my occipital frontal ligament. That's the deep fascia. So by moving my neck back and forth in flexion or extension, I'm actually putting more stretch or less stretch throughout that fascia tray. Okay? So when it was extending backwards, bending forward, you had less stretch on the fascial tray. So I could give me one indication of information. The next indication, what I asked him to do, I didn't ask him now to tilt left and right. I actually, if we're speaking about, for example, his right side, I asked him to tilt his body. And at the same time, as you can see, when I'm starting to do internal rotation, okay, or external rotation, internal rotation of my right and external rotation of my left, of my hip, I'm actually starting to stretch this whole area out of my, which we can see the Shaoyang foot, plus the Taiyang, okay? And then again, I asked him now, extend your neck more, stretch your neck more or less. And when he turned his neck, that pain started shooting up more and less. And then I asked him rotate back, and then he had less pain. So that already gave me a full target that I'm correct, that I'm in the Shaoyang channel or Taiyang channel. So now I go back to his story that his key problem was actually the area of the ankle that was damaged. So I went down and I palpated the area of the ankle. Now, in the somatotopy, which I spoke in the third lecture, I speak about this, the area of the ankle. When I just touched the area of urinary bladder 60, urinary 61, it was very, very painful, very slight touch, shot, very painful, gave him a lot of pain there. So what I decided to do in this case, actually, there we go, sorry. Okay, so I used the ankle somatotope around the area of the ankle on ankle somatotope. There was high sensitivity around bladder 60. Okay, and I palpated on the left side and I inserted the needles there. And when I inserted the needles, I started playing around with the needles because I wanted to actually start breaking up the connective fascia there. Maybe there was damage 2 years ago, which is causing that problem. Okay, and that also, the area of the ankle in that region also influences the upper back up to the head, okay, right on the dew channel. And also with that area of the ankle, I also treated the area of the dew channel and the bladder channel. Okay, so that was the first thing. Then the next, I decided to insert the needle into small intestine 3 on the right side because I want to release, again, the upper right side of the patient, and this is what small intestine 3 can do. At the same time, I also used isomatotope to treat these regions. So the isomatotope, as you can see here, as an area that treats the cervical spine, the lumbar spine, and the thoracic spine, and also the upper extremities. Okay, so on his left side, I needled the area of the ankle to treat the somatotope. Okay, on the, and also the lumbar region, because that was we having a lot of sensitivity. And on the right side, I needled the cervical spine. Okay, now as you can see this image, it's very, very close to the ear. It's very straightforward. You have right on the close to the ear, where the ear and the face meet, you have the cervical spine. Up here is C7, down here is C1. The lumbar spine is spread out right throughout the mastoid process and the mastoid bone. When you go up with the mastoid, then you have a ditch. Okay, in the upper part of the mastoid, that's the area where the hip comes out and then the leg goes. And the apex line is just the, if you multiply your height of your ear, you have the whole area of the thoracic spine. Right by the ear, close to the ear is T1. And if you multiply the height of the ear, it's about 4 centimeters up here. You have the connected point of T11, T12 region. So you have the whole thoracic spine and the elbow and the foot. And at the next, afterwards, I went and after I took out the needles, I gave for about a minute just strong manipulation on the area of the ankle. Okay, and I started seeing that slowly, that I was getting that gliding feeling back in the area of the calcaneus. It was the area of the calcaneus bone and the area of the fascia that covers the calcaneus. I was getting more and more gliding motion. So I'm actually freeing up this fascia throughout the whole channel. And then afterwards, when I asked him to get up, and I said, okay, now get up and do your motion. So when he done his rotation with the neck, he felt the pain was actually subsided by about 50 to 50%. And when I asked him to tilt forward and bring his head into a flexion, also he felt that there was improvement in about 50%. So that was this treatment, which was the key treatment in treating that patient, which brought to amazing results. I spoke to him because in that evening, I actually found out that I have to go into quarantine due to being positive to corona. So I haven't seen him since, but I spoke to him on the phone and he said ever since that treatment, he's had an 80% improvement and he feels that he can walk again. Even if he could walk for about a minute, now he can just walk, no problem. He can go to his daily walks, daily workout, and daily live his life with no pain, with still slight still slight sensitivity in the areas, but he sees it's going improvement. But I want you to see this is a connection between needling points on the scalp area which will treat the scalp throughout the body, and also needed in the areas of the ankle, and having this connection of this fascia that actually is kind of a gate or bridge between all parts of the body. If we think about the fascia, it connects that whole body into one system. And so this is just an example of the two ideas. So thank you very much for joining me. You have my website information. You can go to my website if you want to read more about it. You have my email. Thank you very much for joining me. Have a good weekend and keep safe.